To our webinar today on prioritising adolescent mental health in low and middle income countries. I think there'll be a few people joining over the next few minutes, and I'll just open, I think, to say, firstly, thank you for joining us. I think we have an audience and a set of participants from around the world today. Our webinar is going to be participative in the sense of we'll have some great presentations for you from a number of speakers who've got brand new research to share. And we'll also have opportunities for you to discuss, to pose questions and to take part today. So thank you for joining us. I would say, I think at the outset, that I think most people on the webinar today will have in their minds that adolescent mental health is something pretty important. I would hope that by the end of the webinar, then we'll come away energized also with some new ideas as to how we can help, I think, support that agenda and encourage, I think, the development of the support and the prevention programs that are needed to encourage better mental health. We know at the moment that mental ill health is a major cause of morbidity and mortality among adolescents across the world. And in particular, we know that in a lot of countries, the support and the provision and prevention programs are currently inadequate. So that's something that I hope will be getting some further energy and points for action in the course of the webinar today. We've got a great range of speakers, as I've mentioned. I'll just be introducing them shortly. Our plan for today, firstly, we'll have a number of presentations. After each of the speakers, we won't be having specific questions, but then after everyone has presented, we'll have an opportunity for questions from the audience. At that point, please, if you would like to pose your question yourself, that would be great if you'd like to speak. Otherwise, please pop it in the chat and either you can speak to your question or we'll raise it for you. We'll then have an opportunity in some breakout sessions, which will be an opportunity to have a conversation more. What we'd like you to do in those sessions, I think, is think about what are the priorities that you have heard in the presentations in terms of taking forward this agenda and getting the priority that's needed for adolescent mental health. Rather than have report backs from each of those groups, what we'll ask is that one person in each group will report back in the chat box. And because we're recording the webinar, we'll have a record there and we'll be able to share that following the webinar. After the breakout sessions, we've got a fireside chat. Unfortunately, we don't have a real fire, but hopefully you're warm enough and cozy while you're listening to us wherever you are. And we'll have a number of questions there. We'll have the presenters not in presenting mode, but giving us some reflections, I think, on the agenda, the things that they're working on and the things that they feel matters. And then we'll open up to you, I think, the audience, in terms of questions and comments from your side. So I'm hoping that we've got quite a full agenda there. I'd be delighted now to hand over to our first speaker. Our first speaker is Dr. Ishu Kataria. Ishu is a colleague of mine in the Centre for Global Non-Communicable Diseases at RTI International. She is a senior public health researcher and she's worked for some time in NCD prevention and control in India as well as globally. She is very experienced in the design and implementation of programs, including in relation to cancer, adolescent non-communicable disease prevention, and around behaviour change communication. And I'm delighted now to hand over to Ishu, who's going to present in relation to the adolescent mental health investment case. Thank you, Ishu.
Thank you, Angie. Thank you. And a very warm welcome to all. Pleased to join you all. I hope you can all hear me very clearly. So I will be talking about our work from the Center for Global Non-Communicable Diseases at RTI International for making the case for investment in adolescent mental health. Next slide, please. So I want to, at the outset, mention that despite the high burden of mental disorders that is among adolescents and potentially sort of the lifelong consequences of these conditions, access to mental health services remains a major problem, especially for adolescents in low and middle income countries. while we sort of fully support the initiatives to build mental health resilience and promote good mental health, this study, the work that we undertook, really focuses on what needs to be done for preventing and treating poor mental health. Next slide, please. So just to set the context of why we embarked on this piece of work, is that about 254 million adolescents and young adults experience mental health disorders per year. And most of these disorders actually start at a very young age. About 50% of them begin before 14 years, and about 75% of them begin before 24 years. So you can understand that the magnitude of this is quite large. And about 80% of adolescents who are trying to access any services for mental health disorders really cannot access them. They cannot access the treatment for any mental health disorder that they might be facing. So what it showcases here is that there are many unmet mental health needs, and this is across the globe for young people. Therefore, at the Center for Non-Communicable Diseases, we conducted a globally representative investment case. And our aim was to really quantify what would be the return on investment for interventions that are either used for prevention or treatment of mental health disorders among the adolescent population. Next slide, please. So before I move on to what we did, it is really important to understand what an investment case is. So an investment case is basically an economic analysis. In this economic analysis, what we do is we anticipate what would be the cost effectiveness of a set of interventions, and these interventions are related to the conditions that we are looking for. So what it identifies for us is what would be the cost for inaction and versus sort of the action that you would take on any condition. So for example, if you are investing in adolescent mental health, what would be the benefits that you will get versus if you do not invest in adolescent mental health? And when we look at the benefits that come from these economic analysis, we look at them in two aspects. So we look at them from a health perspective, and we look at them from an economic perspective. So while we now understand what an investment case encompasses, what we did is that we conducted a global investment case. So we looked at many countries across the globe, across different income groups as per World Bank, and we then assessed the impact of mental health interventions for adolescents. And we looked at the impacts on health, on education, and economic outcomes. We looked at all these impacts over a period of 80 years. We focused on most prevalent conditions globally. So you see anxiety, depression, and suicide, and also bipolar disorder, which could be lower in prevalence, but it has a very high impact. Next slide, please. So when I was talking about intervention, we looked at a package of interventions. As I said in the beginning, we looked at both interventions that focus on prevention as well as on treatment. This slide, I'm going to talk about the interventions that we looked at that focused on prevention for the high priority conditions that I just mentioned. So for universal prevention of anxiety and depression, we looked at an intervention that was school-based prevention and that was delivered by teachers. For indicated prevention of depression, we looked at screening. And for prevention of suicide, we looked at prevention in schools or follow-up prevention in hospitals for those adolescents who might have self-harmed themselves. Next slide, please. Moving on to interventions that are now focusing on treatment. For treatment of anxiety, we looked at multiple interventions. These included in-person group cognitive behavioral therapy, CBT, as we very commonly call it, individual CBT, which was delivered through an internet platform, or any internet-based guided self-help. Very similar for the treatment of mild and moderate depression, the interventions were. Moving on to treatment for severe depression, this was medication and in-person individual CBT. And finally, for the treatment for bipolar disorder, we looked at family-focused treatments and medications that were suggested for bipolar disorder according to the state in which the individual was diagnosed at. Next slide, please. So finally, when we had them all in our economic analysis model, what we found out that for every $1 that you invest in the package of interventions, and by package, I would repeat again, I mean the interventions that I was talking about with regards to prevention and treatment, what we get in return is $24 in both health and economic benefits. When we look at the cost effectiveness of the package, we saw that this was cost effective for all country income levels. And the highest return on investment, so where it would give you the maximum benefit, we saw that happened in low and middle income countries. So it just showcases how critical it is to invest in adolescent mental health. Next slide, please. We did a further subset of analysis where what we also identified the interventions where we would find the highest return on investment. So the blue section that you see is the intervention that is from the prevention category. So it is the universal prevention of anxiety and depression that gave us the highest return on investment. And in the yellow section, where it is the treatment of mild and moderate depression, we looked at 3 interventions that gave us the high return on investment. Next slide, please. So based on the study that we did and the findings that we got, we also identified some areas that would be useful for further research. So these actually span across different domains. And what you could see on the screen is actually trying to understand how do you sort of tailor and scale up interventions? How do you make the interventions context specific, especially for low and middle income countries? Looking at how we can look at gendered influences with regards to intervention design, as that might be very critical when we are designing interventions. And finally, how do we reach vulnerable people? So for example, people who might be out of schools or in extreme poverty. Next slide, please. And finally, I'd also like to just very quickly update you that this was sort of phase 1 of the work that we've done. And for phase 2, we are doing country-specific national investment cases. Last slide, please. And thank you. And I will be happy to answer any questions that you might have.
Fantastic. Thanks, Ishu. So we'll save the questions to the end after all of the speakers have presented. And I'm delighted now to introduce Dr. Shoshana Fine. Shoshana is an assistant scientist in the Department of Population, Family and Reproductive Health and the Department of Mental Health at Johns Hopkins Bloomberg School of Public Health. Her research centres around investigating and improving mental health and well-being among vulnerable populations in the US and around the world. Handing over to you, Shoshana. Thank you.
Thank you so much, Angie, and hello to all. And thank you so much for the opportunity to present during today's very important webinar. As mentioned, my name is Shoshana Fine, and I'm an assistant scientist with the Global Early Adolescent Study at Johns Hopkins, where my research largely focuses on adolescent mental health in low resource settings. And today I'm going to be presenting an overview of some of the key findings from our recent 13-country qualitative study of adolescent mental health. Next slide, please.
No worries.
Next slide, please.
I was just saying I was really relieved this morning to realize this wasn't scheduled quite as
Hi, can I just ask, if you're not speaking, could you please pop yourselves on mute and then the speakers will have the floor. Thank you. On you go, Shoshana. Thank you.
Thank you. So this study was initiated as part of UNICEF's 2021 State of the World's Children report, which focused specifically on child and adolescent mental health. And UNICEF asked Johns Hopkins to provide primary qualitative data on adolescent mental health from a diverse selection of countries in order to complement existing quantitative analyses in the report. In collecting this qualitative data, we were guided by 3 broad research questions. We wanted to understand adolescents' perspectives on significant mental health conditions for people their age, to understand adolescents' perspectives on what causes and protects them from mental health conditions, and to understand the ways in which young people cope with mental health conditions, including both barriers and facilitators to help seeking. Next slide, please. In order to answer these questions, we collaborated with partner organizations in 13 countries to carry out a series of 71 focus group discussions with adolescents. As you can see on this map, we intentionally selected a group of countries with broad geographic, economic, and cultural diversity. At least 4 focus group discussions were held in each country, equally divided by sex and age, such that there were 2 younger groups and 2 older groups held separately with boys and girls. And these discussions were audio recorded, transcribed, and translated into English for analysis. Next slide, please. So, as you can probably imagine, given the breadth of our research questions and the large number of focus groups held, this study really yielded rich data on a wide range of topics with relevance to adolescent mental health. But given the limited time today, I want to focus on 3 overarching messages that I think have real implications for research, policy, and practice in this domain. Next slide, please. So first off, we found that adolescents often describe, understand, and communicate their mental health challenges in terms of distress rather than disorder. And what I mean by that is that adolescents predominantly use non-clinical terminology when discussing mental health. So for example, sadness, stress, or defeat rather than depression, anxiety, or PTSD. I think this is powerfully illustrated by this quote from an older girl in Egypt who said, "Being tired psychologically means that you feel that you are not living life and are unable to do anything and are bored, keeping to yourself, and you don't want to deal with anyone. Even if you are ambitious, you will not be able to achieve your ambitions because you are psychologically totally defeated." Now, I'm not trying to suggest that adolescents around the world don't suffer from what we would consider diagnosable mental health problems. Instead, what is clear from our findings is that taking a purely diagnostic clinical approach may exclude many in need, and that above all, we must listen to and use the language of adolescents themselves when attempting to address their mental health. Next slide, please. A second overarching finding relating to the immense importance of social, cultural, and structural contexts in driving adolescent mental health challenges. For many adolescents, in the way that they talked about these issues, it was clear that mental health challenges are often completely entangled with underlying contextual conditions. So, for example, adolescents discussed the ways in which mental health challenges would stem from family adversities, physical and sexual violence within their communities, profound conditions of poverty, stressful academic environments, restrictive gender norms that both devalued girls and precluded boys from expressing their emotions or seeking help for their problems, damaging social media culture, and of course, COVID-19. And what was abundantly clear across these focus groups is that improving adolescent mental health requires attention to these contextual factors. For example, this older boy in Malawi described how poverty, school restrictions, and peer violence could intersect to impact mental health. At school, he said, there are rules that everyone should dress up completely. You need a good shoe. You find that at your home, they cannot provide that for you, and you're putting on Crocs. Others, they get that Croc and start throwing it at each other. Look at this, and the whole class starts laughing at you. It is so painful for us young people. So without any emotional or psychological support, that is when you hear that a student has committed suicide. Next slide, please. Above all, we heard that adolescents around the world need much better formal and informal support to address their mental health challenges. I think it's important to mention that family and peer support arose as a powerful buffer against these challenges around the world. and that in the best cases, these informal sources of support can serve as gatekeepers in connecting adolescents to more formal services when needed. That said, it was abundantly clear that adolescents generally would like more support than is often forthcoming. In particular, adolescents reported frequently masking their mental health struggles due to worries about invalidation, judgment, or ostracization, which is clearly related to deep stigma regarding mental health challenges which exists around the world. And as a result of this stigma, many adolescents described coping without sufficient support, often using maladaptive strategies. For example, this younger girl in Jamaica said, "I know a lot of people who have been going through situations where they are depressed, and they don't tell their stories, they don't talk to you about it. Every day that you see them, they have a smile on their face. They try to behave as normal as possible so that you don't ask questions." And this was echoed by an older girl in Chile who said, "It is difficult for young people to ask for help because of being criticized, judged. They prefer to keep quiet instead of expressing themselves to others." Next slide, please. So where does all of this leave us? First and foremost, I'd like to suggest that we, and by we, I mean researchers, policymakers, practitioners, educators, and advocates, need to understand that just because distress does not always rise to the level of psychopathology, it in no way minimizes the pain that adolescents experience. We need to destigmatize mental health challenges so that they are seen like any other health condition as deserving of help. We need to ensure that adolescents have access to affordable, confidential, and youth-friendly mental health and psychosocial support services within their schools and communities. And perhaps most importantly, we need to work to address the many social and structural issues that give rise to mental health challenges in the first place. Next slide, please. Before I leave you, I'd like to acknowledge the immense amount of work from partners around the world that went into this study. This includes folks from Hopkins, UNICEF, research and program specialists from 13 countries, Wellcome Trust for their support, and most importantly, the young people who participated in the focus group discussions. Next slide. And if you'd like to learn more, you can find further information about this study at our Global Early Adolescent Study website. Thank you again for your time, and I really look forward to our conversation.
Thank you so much, Shoshana. I'm delighted now as our third speaker to hand over to Miss Angelica Duarte. Angelica is a graduate in social work and a specialist in gender and sexuality. She has extensive experience in implementing public policies in the area of gender, health, and economic empowerment. And since 2020, she's been the coordinator for the Young Health Programme at Plan International in Brazil. Handing over to you. Thank you, Angelica.
Hi, Angie. Hi, everyone. Thank you for the opportunity. So I'm going to be presenting the young people's mental health and well-being study with the main findings from Brazil. Next, please. So the research had a focus on Brazil, Kenya, and India, and its objective was to provide insight into the policy environment around young people's mental health, to understand the linkages between young people's mental health, gender norms, and NCD risk factors and behaviors, but also to gain some insight into young people's gendered experience of mental health and their access to appropriate mental health services, and to understand the impact of ethnicity, socioeconomic status, sexual orientation, and other factors on their experience. Next. So the study had a methodology mainly qualitative. We had in all three countries interviews with some stakeholders, but also focus groups with adolescents, and we had a few single-sex groups, which means groups made only for boys and only for girls, and we also had some interviews with young people. Next, please. So what are the factors that impact girls' mental health? Gender inequality and related cultural norms and practices as being particularly detrimental to girls' mental health and well-being. They also experience a lot of gender-based violence and controlling regimes on how girls live. The factors that impact boys' mental health, they are also related to gender norms. The expectations on being manly, the pressure to suppress their emotion and needs, but also social pressures to be strong and resilient as a man means boys find it hard to talk about their feelings and open up. So we have a boy from the focus group who said, with boys, there is a demand to be macho. From when boys are kids, there is a demand. Even though I was still a kid and it's normal to have a thin voice, people would say, thicken that voice, speak like a man. So we see that boys are also affected by the gender norms and it also affects their mental health. Next, please. For the power and agency of girls and boys to mitigate their mental health stressors, girls have less power and agency in society to modify their behavior, to improve their well-being and take charge of their lives. Also, girls, they have more housework and caring responsibilities than boys. And this lack of free time also means less autonomy over their lives. When we are talking about the NCD risk behaviors, they work as coping strategies. So both young people and stakeholders agree that the NCD risk behaviors such as tobacco use, physical inactivity, the use of alcohol and unhealthy diets, they were described as coping strategies for the stress in young people's lives. And many of young people saw these risk behaviors as an unhealthy distraction from stress, boredom, and dissatisfaction with life, and this especially during the pandemic. Next. When we are talking about the appropriate access to mental health support, both boys and girls spoke about going to their parents and how for some of them, their families represent strong sources of support. However, they also mentioned that their parents often have a lot of judgment and this sometimes make it difficult to talk about. Many said they would go to friends for support, and they also spoke about not feeling confident that there would be specialized services for young people's mental health. Many of them also mentioned that there are services for those who reach the crisis point, but fewer entry points for young people to go to. And here in Brazil, we also noticed in the study that a few young people from the rural communities reported not having access to mental health services at all. When we are talking about addressing NCD risk behaviors as positive protection for poor mental health, many stakeholders pointed that there needs to be much more focus on preventative mental health services rather than only curative. And they also pointed that focusing on NCD risk behaviors could be the key to this. Young people also talked about the importance of exercising and keeping healthy and suggested more and different activities in their communities. And they also mentioned problems with accessing adequate and safe outside play spaces for young people. So the physical activity, they spoke about the importance, but also the difficulty to access this kind of service. Next, please. So what do young people see as key issues affecting their mental health? Girls spoke about anxiety around menstruation, especially when they don't have information about that. Both boys and girls recognize there is more pressure on girls than boys to follow cultural expectations. Boys and girls agree that boys are more impacted by expectations not to cry or show emotions. And the expectation that boys and men should be able to manage alone without emotional support is to escalate the difficulties they face. And what is the attitude towards mental health in the community? In all three countries, the young people said that mental health was not spoken about within society. Stakeholders and young people, they agreed that it is more important, it is important to sensitize the community to better understand and speak about mental health without the stigma. And they also suggested meetings between parents, children, and elders to talk about mental health. Next, please. So this is interesting. We are also talking for me to finalize my presentation, we are also talking about what is affecting their mental health for boys and girls and what the young people say about that. And boys, they are more likely to engage in drinking and drugs because of being bored or stressed, especially during the pandemic. And girls and boys spoke about pressures from society on the gendered roles expected of boys and girls. And girls and boys spoke about pressures from the media, including images and cultural messaging that impacted their self-esteem and body image. But they also agreed that this is worse for girls. And the boys, they emphasize the pressure on girls to present in respectable and modest ways to gain respect. Whereas girls spoke about the pressure they felt to have the perfect body and present themselves as sexually attractive. Some girls, they also spoke about how their self-esteem was strengthened by rejecting the pressure to present as hypersexualized to feel powerful. So many girls, they spoke about how they and their girlfriends are impacted by beauty standards. So I'm going to leave you with the last quote from a girl here from Brazil. And she says, I see many girlfriends who cry, who leave the house because they don't like their body and don't like their face and don't like the uniqueness of who she is. And that's really bad to be stuck in a social standard. So there should be no standard because people are different. Getting stuck in the social standard really messes with people. So thank you for your time. And I guess the research also talks, points out the relevance of gender norms in mental health and how it impacts young people. And thank you.
Thank you, Angelica. That was great. In terms of, I think, some of the themes that certainly came out in our session, we had a number of things raised, whether it's the importance of gender, whether it's why governments aren't investing in young people's mental health better, whether it's having better support structures for young people and thinking about how we support teachers, or whether it's about mental health stigma. So there's a lot going on. There's a lot, I think, of people on the call today. So I think if you've got a question, you've got a comment, we're going to open the fireside chat now, without the fire, but with plenty of discussion, I hope. So if you can please keep your comment and we'll move on to that. So I'd invite us now to gather around the virtual fire, and we're going to move over to have the chat with some questions, I think, for our speakers. So I'm going to start with our speaker, Marlene, who is Marlene Carrera. She's a lead peer educator for the Young Health Programme in Kenya. She's a mental health youth advocate in one of the biggest slum areas in Africa. And she is a big supporter, in her own words, of a world that is free of NCDs. And she's very keen on promoting awareness of mental health concerns. So can I ask Marlene, I think my first question to you. So we've heard presentations from around the world around how young people think about mental health and a little bit about some of the programs on prevention and services that can help. Could you share your perspective on why these issues haven't had enough attention to date, do you think, in either your country, in Kenya, or more widely?
Thank you so much, Angie. I'm happy to be here. I'd say coming from one of the largest informal settlements in Africa, which is Kibera, and also just Kenya as a whole, there's a transition from now when we were in the pandemic, and there's not really so much attention that is being put into mental health. There are no deliberate efforts trying to capture the data and everything, especially in adolescents, because being one of the third world countries, we are really trying to get back on our feet in terms of our economy and all that. So in terms of funding and all that, not so much is being done, but there's some little bit of efforts that is being put in place. So yeah, I feel that that is some of the reasons why, as a Kenyan or as a young person from Kenya, I feel like there's not so much attention on data. Thank you very much.
Yeah, I think a case of more can be done, definitely. And COVID has been a big influence across many things. But again, I suppose from what you're saying as well, with an issue like mental health, it's something that needs the attention, even if there are other issues like COVID taking that away. Another question for you, Marlene. Can you share your thoughts in terms of what you would like to see happen? So we've talked a little bit, I think, about what isn't happening. What would you like to see happen from what you've seen and what you work on?
Yeah, I feel like there's also, if there can be positive thinking around mental well-being, because just as Shoshana had mentioned, this is something that is real. COVID-19 mental health is something that is real, and people need to start giving it the attention that it requires. Because if a young person is actually going through something, it needs like attention and support. If the support can be there, right from the parents to the teachers and the community as a whole, a lot can be done to curb the rise in mental health cases. And in an African setup, there's a lot of myths surrounding mental health. Once you go to maybe your parent and you're telling them you're depressed, or you're telling them that you have anxiety, you're always cancelled just at the point of you speaking up. So if people can try and demystify these myths, it doesn't necessarily have to be witchcraft, or it doesn't have to be that you're abusing drugs or anything. It's just you're not feeling okay, you're feeling sad, you don't understand what you're going through at that particular moment. So you need someone to help you understand your emotions, to curb it maybe progressing to severe depression and all that. And there's, as a government, I feel also something can be done, because just accessing this like basic counseling is very expensive. So coming from maybe a middle income family, or maybe a poor family, you can't really afford this. But if there are policies put in place to make sure that young people, adolescents can access counseling at an affordable, even free if it can be possible, so that we can help them at that stage of realization. And I also feel like we should also try and understand what is the root cause. Why is there so many cases being reported surrounding our mental health? And when we get to understand, then we can also try and come up with possible solutions at that level. It doesn't have to be like a global solution, like in Kibra, where there are so many cases surrounding mental health. And is it the economy? Is it the family? Is it just the surrounding? And what can be done to try and get to the people, to the young people who have not yet reached at the stage of mental health being severe. So I feel like there's still more that can be done. In as much as the realization is there, what more can be done?
Thank you so much. I think you've come up with some fantastic solutions there. I think if we put those into practice, Marlene, we'd be doing really well. I'm just going to hand over Issue and bring you in, I think, with a couple of questions. So the RTI research is identifying the power, I think, of investing in interventions that the evidence says do work. So what priorities, what priority actions would you like to see happen to actually get this put into practice?
Thanks for your question, Andy. I think I will put forward 3 actions that I feel should be prioritized to see actually things happening on ground. The first thing that I would see is that we need to really set up or build sort of basic mental health infrastructure, especially in countries where there is hardly any access to services available. We've seen that the access issues are a lot around in low and middle income countries. And it's not just sort of the treatment services, but also sort of just discussing in terms of counseling services that are not clearly established. So I think those level of mental health infrastructure at the very basic ground level needs to be established. I think the second point that I would raise is that there needs to be strong advocacy around the issue of mental health for adolescents, and we really need to partner with civil society organizations on. I think these are the organizations that are connected both to people or the communities as well as to higher authorities. So they are the ones that can actually take up messages that are important and bring forward this issue to the attention of policymakers. So I feel that is another key area that we need to work so that these things can be sort of put into practice. And I would say, Angie, for me, the final thing that's important is the kind of awareness that we need to create about these issues. And I see awareness both ways. So for example, if you are creating awareness at, for example, say the school and the community level, where you sort of do capacity building of the teachers, and so the students understand it, it will also be a way to create demand for services. And so you can help set up the infrastructure as well. So I see it as both ways in a way that it will create demand and supply chain. And therefore, the awareness to me is very important. So I think the 3 priority actions in summation would be sort of setting up or building basic mental health infrastructure, advocacy around the issue so that it can be brought to the forefront, and finally creating awareness about this so that there can be some sort of response generated or demand generated for services that would be needed.
Thanks, Issue. Again, some really powerful, I think, points raised there that I think putting those into action would go quite a long way to addressing some of the issues. Turning to you, Shoshana, can I ask, out of your research, you distilled that beautifully into 3 key issues. What would you say would be the single most powerful message that came out of that?
Sure, yeah. So yeah, I gave you 3 messages, but I'll try to distill our findings down to 1 message if I can. And quite honestly, I think that the most powerful message to come out of this research is a pretty simple one, and that is that many adolescents living in extremely diverse contexts around the globe, and that's including low, middle, high-income country contexts, that many adolescents are struggling with mental health challenges, and that these challenges can really deeply impact an adolescent's ability to function on a day-to-day basis, and that adolescents often feel entirely lost in trying to obtain sufficient support. So I think it's a really personal issue for many adolescents around the globe. And as a result, and for everything that's been presented today, it's clear that we need to do a better job of providing that type of support.
Exactly. Couldn't agree more, I think, with that. How would you say, I think you noted that your research spanned a lot of countries. So would you say that you noticed more in terms of similarities or more in terms of differences, I think, between the countries? Because the countries are clearly so different, but potentially some similar things are going on.
Yeah, absolutely. I think that's a really interesting and important question. Adolescents across the 13 countries didn't always use the same terminology to describe mental health issues. I do think a notable similarity is one that I mentioned in my presentation, which is that adolescents often use terms of emotional and psychological distress rather than mental disorder. And we really saw that around the globe. And along these lines, I do think we did see differences in terms of mental health literacy around the world. And so it was clear, and I think this does relate to sort of terminology that was used, it was clear that adolescents in some contexts had more previous exposure to diagnostic categories such as depression or anxiety or eating disorder compared to others. All that said, where we saw the most notable differences across countries was really in terms of the contextual drivers of mental health issues, and in terms of specific drivers that seem to be the most salient for adolescents. So for example, I mentioned restrictive and inequitable gender norms. And these arose around the world. They really did, as impacting mental health. But that said, I think they came up most powerfully, particularly for girls, during our focus groups in Egypt and Jordan. And likewise, for social media, we unsurprisingly saw a greater emphasis on this in middle and high-income country contexts where adolescents generally have better access to digital technologies. So for me, is where the most differences really arose.
Really helpful. Thanks, Shoshana.
Sure.
And Angelica, turning to you, do you think that there is a difference between what I think the plan research was showing in terms of young people's perceptions and those of adults? And adults are usually the ones who make decisions that affect young people's lives. So what did you see, I think, in your research in relation to that? Oh, we don't have Angelica. Or do we? We don't. So I will hand over, and I think what we'll do, I think, is Marlene, a further question, I think, for you from my side, and then we'll open up to the audience. I think would be in terms of this issue about the difference that you mentioned, also about intergenerational issues. So young people may feel the need to raise issues, to discuss, and older generation may not be so willing or so comfortable for that. Is that something that you have a particular suggestion around? Is Marlena still with us? I'm just having a little look. Marlena?
Yes.
Ah, lovely.
There's a huge gap, especially in prior years. Like our parents never used to subscribe to the idea of mental health or talking to their parents about what they're experiencing. So I feel it has worked, especially in my case, where young people who have experienced some form of training, like myself, on mental health, get to talk to other young people on the same. So in my case, in our project, I have something that is called the Mental Health Cafe, where we get young people and we talk to each other about the issues we're experiencing. Now, if it is an issue that maybe Marlene can't handle, then with the permission of the person that is talking to me, I can do a referral. And that is how we get to support each other as young people. Like, we have our small support system.
That's a fantastic model. Thank you for sharing that, Marlene. I think that's something that I think might well be replicated nicely, I think, in different places. I'm going to hand over now and widen out if there are questions from the wider audience, I think, that you'd like to raise to the speakers. If you'd like to speak, then would you like to just raise your hand and come forth with your question? I can see we've got some nice feedback from the groups in the chat. A lot of discussion going on there. If you have a question that you think is a burning one now, we have a fireside. Please do raise.
Just Angie, I see Angelica here with us, so maybe you can direct the question that you had. She's finally here.
Absolutely, yeah. Angelica, the question that we have in relation to what we've identified as something of a difference between the generations and how they approach mental health, and perhaps their comfort in talking about these issues or not. What did you see from your research, and what might you recommend in terms of how we might bridge that gap that there seems to be?
Yeah, I think for the research, in many aspects, the stakeholders who are basically adults and the young people who joined the focus groups and the interviews, they agreed mostly on the services, on the health services, because they were talking about the importance of having preventative services and actions to address mental health. So I guess this is the thing that pops up the most between them for the what they are thinking the same for the preventative mental health services. But I think the gender experience is more accurate between young people. So this is something more strong between them because they are feeling this in their daily life. So I think this is easier for them to talk about than for the adults. It's something very interesting and curious for us to think about. But I think the other thing they agree to is the stigma around mental health. So they are both agreeing in the study that people in their community, they don't talk about mental health. So they see this as a gap, right? So they are both agreeing also that we need to talk more about that. And I guess it was very interesting what Shoshana said about the language towards mental health, that we should talk about. So young people are not talking really on medical terms. They are talking about feelings. So we need to be able to talk about that with young people, but also with adults, with people who is surrounding young people, so they can realize and identify what they are talking about. So when a young person is talking about their feelings, they are also talking about their mental health. So I think this is something we need to prioritize also, to have a language that is more wide and more general towards mental health, that we should talk about that not only in medical terms. If we want to access and sensitize young people and adults surrounding young people and who are worried about their mental health. So I guess that would be my recommendation when we are, after everything that we talked and saw here from other researchers, that we need to adapt our language and our means to reach young people in a more preventative way. So that's what I would say.
That's super. Thank you. Thank you for that really comprehensive answer. That's great. Can I invite the people who made who recorded the points from the breakout groups? If you've got a particular point that came out really strongly, would you like to share that, I think, with the wider group?
Hi everyone, Lina here. I work at Plan International UK. So I think something that came out of our group in particular was about how this research has shown us how gender norms really affect how mental health then affects young people. So doing more research into that, but then also highlighting that at a policy level, for policy makers to take that into consideration and not having like a blanket approach when it comes to adolescent health as well. So I think that's something that came out strongly. And another point was about how it's important to have strategies and interventions at various levels. So ensuring that we work at the family level, at the community level, but then also at the national and global level when it comes to advocacy work on this important topic. And that, yes, we might have like these common strategies that we come up with, but it would still be important to see how we make those context specific to the different geographic locations or even different communities within the same country. So I think those were the two key points that came up a lot in our discussion. Thanks.
Fantastic. Thank you. Thank you for sharing those. Really important point. I think context matters. Some things are very similar, but context changes, I think, a lot of things as well. Can I go to Sheila next, who recorded, I think, on behalf of your group?
Yes, so thank you, Dr. Angie. So from our group, what came out strongly, and I just want to echo what the previous presenters just said, issues of, avoiding generalization. And I think one of the participants, the group that is Koyet, brought it out very clearly that when you're looking at adolescents, you also have to look at adolescents in humanitarian settings. And then as we are coming up with programs, these programs have to be probably programs that targets adolescents in informal settings, humanitarian settings, and then the general setting, so that we don't just generalize. And then she also brought out the issue of the programs should be developmental focused, because it's not like these adolescents grow up at the same time. So if we're having interventions, then we have to also look at the ages and what needs to be done at what age. And then we also had a parent advocate who brought out the issues of sexual reproductive health with focus on behavior. And he strongly said that we need to also think about advocacy programs that look at the needs of these young people, because some of the MH issues that they have are centered around sexual reproductive health. So they need to have programs that take them through their own experiences so that they're able to deal with them in a much better way. And then finally, there was also a strong point on issues of parenting. So as we talk about mental health, we need to also look at parents. And I think Marlene is the one who brought it out very clearly, and she gave an example. If you have got a parent who is always busy trying to, to look for food and just to meet the basic needs, and they have got no time for their children, then issues of communication, issues of trust within the parent and the child slowly generates into distresses that can easily bring about mental health distresses. And therefore, if we can focus on parents, then it will be very easy. By the time now we are bringing in the teacher-specific programs, already these children have got a basic understanding from home. And therefore, it will be easy to just seamlessly connect it now to the teacher program in schools. So I would want to stop there in case there's anything else that probably I didn't pick out. You can add on to it. So thank you, and back to you.
Some fantastic ideas there. Thank you, Sheila. Can I ask Hushali, would you like to just highlight an issue, I think, from your group, if you wouldn't mind?
Sure. We came up with like 3 different issues that were sort of resonated with everybody, is that you have to have a quick way to diagnose what the problem is, to go in, to have some type of rapid intervention, especially in a humanitarian setting, to sort of see, I mean, kids are disrupted lives anyway, but to sort of see what is just sadness or disappointment or discomfort versus a real psychosocial issue that needs immediate intervention for. So to have some way to distinguish between the different levels and when you need to have intervention versus when, to treat the whole community, to do group settings versus one-on-one individual settings. And another one is to sort of look at the social norms and the stigma in each individual community. It's not one size fits all. You can't say what's going to work well in the Philippines is going to work well in Kenya. So you need to understand what the social norms are and maybe how to desensitize some of the community and some of those expectations.
Brilliant. A real case, I think, for implementation research there to understand, I think, the context and how programs that have the same core need to be implemented maybe in different ways in different places. Thank you,
Exactly.
Hushai. Just hand over, Laura, if you wouldn't mind, would you give us just a little précis of some of the issues that came up in your group?
Sure. So building on the points that have already been made about not homogenizing across groups, we talked about particular individual groups who might have different mental health needs and might be particularly vulnerable to poor mental health, and the importance of understanding their individual needs in terms of mental health response and applying an intersectional lens. And then Angelica was in our group. She's already mentioned about language, because that was something we talked about for quite a while. The importance of finding out what language adolescents are using around mental health and ensuring that we're using accessible and appropriate language, and hearing from them on the language that they use and understanding what that means. And then finally, we talked about preventative responses, and the importance of mental health services being situated where young people are, both physically in schools or youth clubs, but also virtually, and the importance of social media and understanding how young people might express their mental health on social media. And I don't know whether Raven from our group is still on the call, but you had a lot of good ideas about social media if you want to come in and share those.
Yeah, I was going to say, at least in the United States, young people find ways to get access to social media. And what are some of the warning signs of, severe psychological distress or mental health issues, or just, the impacts of COVID-19, and being able to distinguish between what's normal and what's not, just using things like, for example, like TikTok videos. So that's really common. A lot of people share their experiences on TikTok.
That's a really, really important point. I think the power of social media, but also the fact that young people are looking for solutions themselves, and maybe we need to be better and more proactive, I think, at providing, things that young people tell us they want in a way that they don't have to go seeking for it quite so hard. That's a really important point, Raven. Just one last question, and I think anyone feel free to answer. I think that there will be a lot of like-minded people, I think, on the webinar today who are thinking this is really important. Why isn't this happening? How can we get it to happen more? Does anyone have, any one point they would want to share on that before we close?
Funding. I mean, that sort of is a roadblock for most programs. It's a question of, it's a very limited resources to do it, and so much need. So that is sort of the elephant in the room, that people can't say that that's not a factor.
And how can we get people, whether it's a government or whether it's a donor organisation, Shelley? Thank you for sharing that pretty important point, but how might you suggest? There'll be all sorts of suggestions, I guess, from different people, but how would you suggest we might actually get that better recognised, that this is important? There are many priorities, I guess, governments, donors are funding, but this, young people are telling us is really important, and it's just not getting the recognition yet.
Right. I mean, that's a big issue with a lot of programs. Children sadly don't have a seat at the table when parliaments and governments and the UN are discussing funding priorities. So empowering these stories would help go a long way.
That's a beautiful point to end on. So I can't top that. So what I'll do is I'll hand over now to our last speaker, who is Miss Courtney Sunner. Courtney is the Global Sustainability and Access to Healthcare Associate Director at AstraZeneca. AstraZeneca is famous nowadays for many things, but in particular, Courtney's role there is she is responsible for shaping and executing the AstraZeneca's approach to dealing with non-communicable diseases through this global community investment initiative they have, which is the Young Health Programme. So in terms of, I guess, an example of a donor that's particularly prioritising adolescent mental health, the YHP is a really good example of that. So Courtney, handing over to you for some closing comments, if you would. Thank you.
Thanks, Angie. And I think what really highlighted to me the most important piece of this research was just focusing on how important it is for young people to have access to support systems and services around mental health. We know that young people are experiencing higher rates of mental health conditions in many countries around the world, whether that's high-income countries or low-income countries. But they're also experiencing more stress, anxiety, and general unhappiness that can lead to more severe disorders if they can't seek the help that they need in the adolescent years. And it's clear that young people's mental health has had various challenges, and we've heard that there are evidence-based ways to address this. At AstraZeneca, we've supported the Young Health Program since 2010. It's our largest global community investment initiative that's active in 40 countries around the world, and we focus on preventing non-communicable diseases among adolescents. We know that mental health disorders are the most common NCD among young people, but they can also exacerbate NCDs. If you're facing mental health conditions or even have higher rates of stress and anxiety, you might be more likely to participate in unhealthy behaviors like smoking or excessive alcohol consumption or just not getting enough exercise, and that can impact your health. So by supporting our partners like RTI, UNICEF, Johns Hopkins, Plan International, we hope that we can help raise awareness, advocate, and empower young people to realize their right to good mental health and well-being so that we can collectively make a difference. And I absolutely do agree with you about making sure that young people need to be placed at the decision-making tables. And through our youth leadership pillar, that's something that I'm also personally very, very passionate about, and look to equip and empower young people to not just have a seat at the table, but to make sure that they have access to opportunities, access to funding, to networks, to mentorship, to resources and development opportunities that will enable them to not just talk about it, but make it happen as well and create the change that they want to see. So in closing, the findings of this research presented that all stakeholders, whether that's national governments, international organizations, the private sector, and communities, especially with young people involved in decision-making, need to work together to address mental health promotion, prevention, and treatment for young people. And I just wanted to thank you all for joining the webinar and participating in this great discussion around mental health among adolescents. And I'm happy to connect with any of you who are interested in learning more about how we do our work to support the health and well-being of young people around the world. And thank you so much to RTI and all of our partners for joining as well.
Thank you so much, Courtney, and thank you again to our speakers and to everyone for joining us today. Take care and go well in terms of promoting adolescent mental health. Thank you.